Hi, my name is Marissa Martinez and I'm here and I'm going to show you how to administer adult CPR. With me I have my Elsa dummy that I made because I don't have a real dummy. So the majority of out of hospital cardiac arrests happen in places that are known to you. A nursing home is 11.7%. Public settings is 18.8%, and home and residences are 69.5%. So I want to teach you how to do the proper CPR on an adult. So I'm going to show you how to assess the situation. I'm going to show you how to do the CPR steps, and I'm going to tell you what to do if a crowd forms and what to do when the paramedics arrive. So when you stumble upon somebody who's unconscious, you go up to them first and you tap them on the shoulder and you ask them, "Are you okay?" If they don't respond, you have you take no more than 10 seconds to assess their breathing. And if there is no breathing, you start doing chest compressions. So with chest compressions, you're gonna have to put your hands in the middle of the person's chest, and you're gonna go in 2 inches deep into their chest while pushing down. It's gonna be scary, there's gonna be some bones cracking, but it's gonna help potentially save their life. So when you do chest compressions, you're gonna wanna do it 100 beats per minute. And when you do 100 beats per minute, you could actually have Staying Alive by the Bee Gees in your head, and that will help you with the rhythm. And when you could actually do rescue breaths as well while doing the chest compressions. You could do, for every 30 chest compressions, you could do 2 rescue breaths. So when you do rescue breaths, you're gonna wanna tilt the head up and you're gonna wanna do mouth to mouth. This is before COVID, but they sell actual masks, protectors that you could keep on your keychain that will go over the other person's mouth. So when you pull up the chin, you're gonna wanna put your hand around their mouth and pinch their nose, and then put your mouth over their mouth and give rescue breaths. If you're gonna wanna look for the chest to rise when you do your rescue breath. If the chest doesn't rise the first time, you wanna adjust their head, so you could try it again, and hopefully the next rescue breath will go in and you can see the chest rise. So when you do that, it's 100 beats per minute. You're gonna wanna do the CPR steps again. So every 30 chest compressions, you give 2 rescue breaths, and you can just keep doing it. It will get tiring, but if a crowd forms, have someone do CPR with you. Yell out and ask if anybody is CPR certified, and they can help you out, and you guys could just switch in intervals. And then you could also have somebody use the phone while you are giving chest compressions, so they could talk to 911 for the operator. So hopefully not too long after you start giving CPR, medical personnel will arrive, the EMT, and then they will take over quickly. When they take over, they're gonna want key steps. They're gonna wanna know when and how long, or they wanna know how long you did chest compressions. So I've showed you how to properly administrate CPR to an adult. You're gonna wanna check the scene, assess the situation, and you learn how to do chest compressions 2 inches deep, and then 30 chest compressions to 2 rescue breaths. And then you're gonna wanna utilize the crowd, and then you know what to do when medical personnel arrives at the scene. All these steps can potentially help save a life. Maybe you should take a class if you want to get more advanced. And then the American Heart Association is the place to go for your classes. It will be helpful if you ever stumble upon an accident and scene like this. I just hope that you would remember the steps. Thank you and good luck.